Hello and welcome to Bite-Sized MRCP, a manageable way to digest the things that you need to know for your MRCP exam. We are two junior doctors based in the UK who have passed all three parts of the MRCP within the last 5 years and want to help you do the same. We're not associated with any MRCP examination organizations, and the materials covered are by no means an exhaustive list of what can come up in your exam, and indeed are not intended to be used as medical advice. Please refer to your College of Entry or your friendly supervisor for further questions regarding the exam and syllabus. If you like the sound of what you hear today and would like to join us for more bite-sized revision, give us a thumbs up and press the subscribe button. Now, without further ado, let's get into today's topic, which is on Yersinia Pestis under the section of infectious diseases. So Yersinia is a zoonotic infection, and it is most common in Southeast Asia and Central or Southern Africa. The pathophysiology of it is that it is a gram-negative rod-shaped cocobacillus. There are three main forms of transmission. One is through flea bites, which is named as bubonic plague. Two is that through direct contact with infected tissue or fluids, which is called as septicemic plague. And finally, as a result of inhalation of infectious droplets, which is called pneumonic plague. The clinical manifestation is that it's normally divided into three forms that we just explained, which include bubonic, pneumonic, and septicemic plague. The bubonic form causes sudden onset of fever, chills, head and body aches, as well as weakness. And this is normally followed by swollen, painful lymph nodes, which are termed as buboes. The pneumonic plague can cause a rapid onset of chest pain, cough, dyspnea, and potentially could even progress to respiratory failure. The management of Yersinia first line is with the use of aminoglycosides, such as streptomycin or gentamicin. The alternatives would be chloramphenicol or tetracycline. However, importantly, prevention is very important, and in this case would be strict surveillance of rodent populations and flea control, especially in the area of endemics, is of critical importance. Let's do some questions. In the context of a bubonic plague, which vector is responsible for spreading the causative bacteria to humans, and what characteristics behavior of this vector facilitates the transmission of the disease? A. Mosquitoes with their blood-sucking behavior. B. Ticks with their prolonged attachment to hosts. C. Fleas with their contact with infected tissue. D. Fleas with their habit of jumping from infected rodent to humans. E. Lice with their close contact with human skin. If you recall, you will realize that in the context of bubonic plague, the way that this is transmitted is through flea bites, which is making the option D the correct option, which is their habit of jumping from infected rodent to humans. Thanks for listening to this episode of Bite-Sized MRCP. If you like what you heard today, give us a thumbs up and hit the like and subscribe button to make sure that you don't miss out on our next episode. Let us know in the comments which topics you would like to hear in the future. See you in the next episode.